Afternoon, everybody. Thanks for joining us today in our cardiovascular ground. Welcome, Dr. Ostfeld, and thank you for joining us. My name is Lorena Cardio, and it's my pleasure to introduce to you our moderator for this event. Dr. Clinical Cardiologist at La Cardio, welcome and thank you for moderating this event.
Fernando, adelante.
Buenas tardes a todos. Muchas gracias por acompañarnos en nuestro Grand Rounds en Medicina Cardiovascular. Mi nombre es Fernando Marín y los estaré acompañando en la moderación de esta conferencia. Les recordamos que al conectarse a esta conferencia, autoriza el tratamiento de sus datos personales, los cuales serán tratados de acuerdo a la Ley 1581 de 2012 y nuestra política de datos personales, la cual puede consultar en www.cardioinfantil.org. De igual forma, les informamos que esta conferencia está siendo grabada. El chat de preguntas se encuentra habilitado en la barra de participantes. Les agradecemos dejar allí sus inquietudes, las cuales resolveremos al final de la sesión. Hoy tenemos el honor de contar con la participación como expositor del Dr. Robert Ostfeld con la conferencia ¿Es la nutrición una opción viable para la prevención primaria y secundaria de las enfermedades cardiovasculares? La hoja de vida y entrenamiento del Dr. Ostfeld incluye licenciatura en Bases Biológicas del Comportamiento de la Universidad de Pensilvania, médico egresado de la Facultad de Medicina de la Universidad de Yale, internado y residencia en Medicina Interna en el Hospital General de Massachusetts. Es cardiólogo subespecialista en investigación en medicina preventiva en Brigham and Women's Hospital, maestría en epidemiología de la Escuela de Salud Pública de Harvard. El enfoque de investigación del Dr. Ostfeld está en la prevención de enfermedades cardiovasculares a través de la modificación del estilo de vida. El Dr. Ostfeld actualmente se desempeña como profesor de medicina y director de cardiología preventiva en Montefiore Health System. El Dr. Ostfeld es autor o coautor de casi 100 manuscritos originales, incluidos libros, capítulos, artículos de revisión y resúmenes, y ha dado conferencias en importantes reuniones nacionales e internacionales. Welcome, Dr. Ostfeld. You may get started.
Thank you, Dr. Marin, for that incredibly generous introduction. And thank you, Dr. Medina, for the very kind invitation to speak with you here. I had the opportunity to work with Dr. Medina for many years at Montefiore. It was a great loss for us when he chose to move on, but I know an incredible addition for you. So thank you so much. Hablo un poquito español, pero no muy bueno, so voy a hablar en English con mi presentation. So is nutrition a viable option for the prevention of cardiovascular disease? And like many of you, we went through medical training and we learned a lot about, diagnoses, treatments, procedures, but at least I learned very little about prevention along the way. And when I was done with my training, I came down to Montefiore to work and did all the things that I was trained to do. Guideline-based medications, procedures, diagnoses, all those things are incredibly important. And I kind of knew that a Mediterranean style diet was helpful, but I couldn't really quite define it. And I encourage patients to eat it in a kind of vague way. And doing all that, people got a little bit better, but they didn't get a lot better. And I didn't go into medicine to help people get just a little bit better. So I was starting to get a little disillusioned. And then I learned about the impact of plant-based nutrition for the prevention of cardiovascular disease. I was really taken by it. One thing led to another. And quite a few years ago, started our cardiac wellness program at Montefiore with the goal of preventing disease with a plant-based diet. I've been a cardiologist now for pushing 20 years, and outside of a medical emergency, like somebody gets shot and has to be put back together, I've never seen anything come close to the breadth and depth of benefits that a plant-based diet provides. So we'll touch on nutrition as a viable option for the prevention of cardiovascular disease. These are my disclosures. And I thought I would start with a case. This is a patient we saw early on in our cardiac wellness program. And he was at the time about 60, and he was having chest discomfort that was getting worse and worse, sometimes walking a couple blocks, sometimes he'd even feel it sitting still. He went to see his primary care doctor, and his primary care doctor got a stress test, which was abnormal, and he was referred to see us. And this patient did not want to take any medications. The patient's the boss. He wasn't interested in aspirin. He wasn't interested in statins. He was also not interested in any invasive procedures, not interested in catheterization or anything like that. And we certainly had informed discussions with him, but at the end of the day, the patient's the boss. And so when we met him, his body mass index was about 26. His blood pressure was a little high. His LDL cholesterol was high, and he could walk on average about 1 to 3 blocks, and he'd stop because of chest discomfort. And at this time, we couldn't use medications because he didn't want to use any, and we did not have any procedural options because he didn't want to have any procedures. So he started a plant-based diet. And what we're going to do is we'll circle back a little bit later to see how he did. So as you all know, cardiovascular disease is unbelievably common, and at least in the US, there are about 2 heart attacks every minute. And it's the #1 killer of adult men and adult women in the US. And women in the US are about 6 to 7 times more likely to die from cardiovascular disease than they are from breast cancer. So clearly you don't want either one, but it highlights the epidemiologic importance of cardiovascular disease in women, and it's a very expensive disease process. And it starts very early in this one quite sobering pathology study of children who died for other reasons. 65% of children between 12 and 14 years of age had early signs of atherosclerosis in their coronary arteries. But that's okay, because it only gets worse. There are pathology studies of US soldiers who died in the Korean and Vietnam Wars. The soldiers, very young, 20, 21 years old, maybe even younger. And from this cohort, these are famous pathology studies, almost 80% of them had overt coronary artery disease. In the Vietnam War one, about 50%. A more recent study of 110 consecutive trauma victims, about 26 years of age, fully 78% of them had overt coronary artery disease. Now, there's an incredible opportunity to help prevent cardiovascular disease. And now from the very famous Interheart study published in Lancet in 2004, about 90% of the risk for myocardial infarction can be accounted for by the following 9 risk factors. And I put a little asterisk by the ones that are really diet, at least in part, mediated. Abnormal lipids, smoking, high blood pressure, diabetes, abdominal obesity, psychosocial factors we'll touch on. Of course, consumption of fruits and vegetables, alcohol, and regular physical activity. These 9 can account for 90% of the MI risk. This is a really fascinating study by Dr. Bundy, published in the Journal of the American Heart Association in 2021, and they tried to estimate risk in the US population. And what they did is they took Life Simple 7 from the American Heart Association: smoking, body mass index, physical activity, a healthy diet score, total cholesterol, blood pressure, and hemoglobin A1C, and they put them all into poor, intermediate, or ideal risk. And the poor was 0 points, intermediate was 1, ideal was 2 points. And I want to focus a little bit on the healthy diet score. The healthy diet score was made up of 5 things. It was low salt consumption, low sugar consumption, meaning low sugar sweetened beverages, low junk food, at least 4.5 servings of fruits and vegetables a day, at least 3 servings of whole grains a day, and 2 servings of fatty fish a week. If you had 4 or 5 of those, you were considered to have an ideal dietary pattern, and it was poor if you had 0 to 1. 0.7% of the US had an ideal dietary pattern, and about 75% had a poor dietary pattern. We have a long way to go to get anywhere within a mile of even decent. So there's a lot of wars about what's the most optimal diet. I think that's a distraction. At least here in the US, we are so far from that. We got a ways to go. And they also looked at a total cardiovascular health score ranging from 0 to 14 points from all 7 of those lifestyle or risk factors. Of course, it got 2 points if it was ideal and 0 if it was poor. And high cardiovascular health, only 7% of the US had what they define as high cardiovascular health, and about 58% had low. So we have work to do, but why does it matter? Why does it matter? Well, they estimated from this study that if everyone in the US developed a healthy diet, after 1 year, cardiovascular event rates would fall by a little more than 40%. So this is the CARDIA study, the coronary artery risk development in young adults study, a wonderful prospective cohort study. And they, in this analysis, say it's from about a plant-centered diet and risk of incident cardiovascular disease during young and middle adulthood. Just have to move this. Young to middle adulthood, pardon me. So, and in this analysis, with about 5,000 people, they have 32 years of follow-up, and I looked at the highest versus lowest quintile of plant-based diet. And if you had the highest versus the lowest over those 32 years, you had about a 52% lower hazard of incident cardiovascular disease. And even if you changed your diet after year 7, you also meaningfully lowered your risk. So it's really never too early and never too late to start. And of course, it's all of the above to protect people. This study gets at that theme from the Framingham cohort. This is Conjoint Association of Adherence to Physical Activity and Dietary Guidelines with Cardiometabolic Health. And their primary outcome here was the metabolic syndrome. So in this analysis of about 2,300 people with 8 years of follow-up, if you adhered to the 2018 US Physical Activity Guidelines, there was a 34% lower hazard of developing metabolic syndrome, okay? And if you adhered to the 2015 dietary guidelines in America, you had a 32% lower hazard. But if you adhered to both, it was significantly lower still. So all of the above, of course, matters. And suboptimal cardiovascular risk is, of course, not just a marker of cardiac risk, but it's also a marker, potential marker of other risk as well. And, I don't really think of it as a heart diet and a cancer diet and a blood pressure diet. I look at it as of course, an overall healthy dietary pattern will help you very broadly. This analysis gets to that theme. And this is risk of future cancer by atherosclerotic cardiovascular disease score. And as you know, there's the ACC 10-year cardiac risk calculator. And so they put people into different percentages, less than 5% 10-year risk, 5 to 7.5, 7.5 to 20, more than 20. And as you can see, the higher the cardiovascular risk is estimated by that calculator, the higher the risk of incident cancer. So let's talk about the impact of a plant or mostly plant-based diet on cardiovascular health and its risk factors. So we'll touch on these 5 general themes: cardiovascular health, cholesterol, inflammation, blood pressure, weight, diabetes, novel risk factors and quality of life, and mortality. Now, specifically in regard to cardiovascular health, when I'm talking about a plant-based diet, the way I'm defining it is a minimally processed or smartly processed plant-based food. So meaning tons of vegetables, fruits, whole grains, beans, lentils, tofu, yams, nuts, and seeds, avoiding junk food, and minimizing or eliminating animal products. And of course, the devil's in the details. You could eat sugar cookies all day and be plant-based, and you could eat kale all day and be plant-based, but there's got to be a difference. And this study looks specifically at that. This is a wonderful prospective cohort by Dr. a study by Dr. Satija. And here they looked at the Nurses Health Study 1, Nurses Health Study 2, Physicians Health Study, and they had about 4.8 million person years of follow-up. And they asked, if you ate a plant-based diet, was it helpful? Was it not helpful? Well, here in this analysis, the more of a plant-based diet you ate, the lower your hazard for coronary heart disease. But there's got to be a difference between cookies and kale, and this study addressed that. So this red line is a healthy plant-based diet, the kale, and this line here is the unhealthy plant-based diet, the cookies. So you can see if you ate a healthy plant-based diet, you did better still. But if you ate an unhealthy plant-based diet, you did quite a bit worse, the cookie group. And here, if you ate a healthy plant-based diet, you can see you did better. This red line here is an animal-based diet, and this line up here is an unhealthy plant-based diet. So in this analysis, an unhealthy plant-based diet did a little bit worse than an animal-based diet. So the devil's in the details. And in this meta-analysis by Reynolds, published in Lancet in 2019, it's a meta-analysis with 135 million person years of follow-up. They asked if you ate more whole grains, is it helpful? Is it not helpful? Well, it was. More whole grains was associated with less cardiovascular disease, less diabetes, less cancer. And this wonderful study by Dr. Du from a large cohort from China asked if you ate more fresh fruit, is that helpful for cardiovascular disease? Is it not helpful? And in this analysis, they had about 450,000 people with 3.2 million person years of follow-up. And they found the more fresh fruit you ate, the lower your risk of cardiovascular death, the lower the risk of major coronary events, less stroke, less hemorrhagic stroke. And of course, the devil is in the details. This analysis published in Neurology looked at the quality of plant-based diet and risk of total ischemic and hemorrhagic stroke. And they found that in quintiles of the highest versus lowest quintile of the healthy plant-based diet was associated with a significantly lower hazard of stroke, and an unhealthy plant-based diet was neutral. This is a busy slide, but I bring this slide up because it's really fascinating study published by Dr. Kara in 2016. And the reason I bring it up is, I'll see in the office, patients will say, Dr. Ostfeld, diabetes runs in my family, this disease, that disease runs in my family, so I'm going to get it. It's in my genes. Well, genes matter, of course, but lifestyle matters too. And this study gets to that. And what they did is they looked at about 26 different genes that can increase the risk of cardiovascular disease. And they put people to three groups: a low genetic risk group, an intermediate genetic risk group, and a high genetic risk group. And you can see the higher your genetic risk, the more likely you were to have cardiovascular disease. Makes sense. But what was particularly interesting to me is that they then split people, let's just look at the high genetic risk group for now, into a favorable lifestyle, an intermediate lifestyle, and an unfavorable lifestyle. And you can see in just the high genetic risk group, if you went from an unfavorable lifestyle to a favorable lifestyle, your risk of cardiovascular disease fell by about 50%. But to get in the favorable lifestyle group, one of the requirements was to exercise. Okay, but just at least once a week. That's it. And you had to eat more healthily than about 50% of the people in the cohort. Imagine if you ate more healthfully than 90% of the people and you exercise 5 days a week. You would think your risk would fall further still. So genes matter, but lifestyle matters too. Okay, that was touching on cardiovascular health. Let's touch on cholesterol, inflammation, and blood pressure. So in regard to cholesterol, this is a great study by Dr. Jenkins' group and his group in Toronto. And they did a direct comparison of a dietary portfolio of cholesterol-lowering foods, which was basically a high-fiber plant-based diet with the statin, which was, I believe, lovastatin 20 milligrams in hypercholesterolemic participants. And it's a small randomized trial. And the control group, which is always important to have, of course, lowered their LDL by about 8.5%. But the statin group, lovastatin 20, lowered it by about 33%, and the portfolio diet, almost the same, about 29%. So an impressive lowering simply from a high fiber plant-based diet. And jumping all the way to Korea, this very interesting study about cholesterol and diet, they looked at the association between different types of plant-based diets and risk of dyslipidemia. It's a prospective cohort study, and they define dyslipidemia broadly. And so this was a sample size of about 4,500 people with 14 years of follow-up. And the quintiles, if you were in the highest quintile versus lowest of a healthy plant-based diet, you lowered your hazard of future dyslipidemia by about 37%. And if you were in the highest quintile of an unhealthy plant-based diet, basically the cookie group, you had an increased hazard of about 48%. So the devil's in the details. Now, as you all know, in regard to atherogenesis, the LDL particle can burrow across an inflamed endothelial cell into the wall of the artery, where it can become oxidized and become highly irritant to the wall and promote inflammation, more endothelial cell damage, cell migration, et cetera. Now, in an interesting small study, vegetarians, the LDL, this is more of a test tube study, LDL particles from vegetarians were significantly more difficult to oxidize than the LDL particles from omnivores. And CRP, of course, the serum marker and potential mediator of inflammation, and we know inflammation, of course, promotes all aspects of atherosclerosis. And in a fascinating study called EVADE-CAD, it's a small randomized trial of 100 people over 8 weeks. And they took people with stable coronary artery disease, and they randomized them to either the American Heart Association diet or to a plant-based diet. And their primary outcome was CRP. And after 8 weeks, the CRP fell significantly more in the plant-based diet arm. How about blood pressure? Well, circling back to the Cardia study, the highest quintile of plant-based nutrition versus not was associated with a significantly lower blood pressure. Of course, there's the randomized DASH diet studies, which are not completely plant-based, but largely plant-based, the dietary approach to stop hypertension diet. And versus more Western style diets in a number of studies, the DASH diet has significantly lowered blood pressure. And in a cross-sectional analysis of the Epic Oxford study, more plant-based nutrition is associated with lower blood pressure. All right, so we touched on cardiovascular health. We touched on cholesterol, inflammation, and blood pressure. Let's touch on weight. So in this is a cross-sectional analysis of the Seventh-day Adventist study. In the Seventh-day Adventist, a religious organization, they treat their bodies like temples, and even those who eat a Western-style diet eat a much more healthful version of it. And in this analysis of about 60,000 people, they were able to break their diets down into different groups: the non-vegetarians, the semi-vegetarians, pesco vegetarians, lacto-ovo vegetarians, and vegans. And the only group with a normal BMI was the vegans. In this small but great randomized trial by Dr. Turner McGreevy, this is looking at the comparative effectiveness of plant-based diets for weight loss. And it's a small 6-month randomized controlled trial, and they had 5 different dietary patterns: omnivorous, semi-vegetarian, pesco-vegetarian, vegetarian, and vegan. And the vegan group lost 7.5% of their body weight over the 6 months, and significantly more weight was lost in the vegan group compared to semi-vegetarian and omnivorous, but not significantly different than the vegetarian group. So impact of a plant-based diet. We touched on cardiovascular health, cholesterol with the portfolio diet, inflammation in part with the EVADE-CAD study, blood pressure, DASH diet, Cardia study, Epic Oxford study, et cetera, the weight as well, randomized trial, and the cross-sectional analysis. How about diabetes? Well, in that same Adventist study, cross-sectional analysis, the group with the lowest percentage of diabetes was the vegans. And in this fascinating study, this is out of the Nurses' Health Study 1, Nurses' Health Study 2, and Physicians' Health Study with about 4 million person years of follow-up. This is a plant-based dietary patterns and incidence of type 2 diabetes in US men and women from those 3 prospective cohorts. And they put people into different deciles of a healthy plant-based diet and deciles of an unhealthy plant-based diet. And if you were in the highest versus lowest decile of a healthy plant-based diet, you lowered your hazard of incident type 2 diabetes by about 34%, and unhealthy, you increased it by about 16%. This is along the theme of it's never too early to begin being more healthful and it's never too late to start. These are changes in plant-based diet indices and subsequent risk of type 2 diabetes in women and men from the same 3 prospective cohorts. This had about 3 million person years of follow-up. Each 10% increase in a healthy plant-based diet over 4 years was associated with a 9% lower risk of incident type 2 diabetes. It's never too late to start. And in the Seventh-day Adventist study, this is a cross-sectional analysis of 8,400 people from that group, at least weekly intake of an animal product versus none is associated with a 74% higher odds of type 2 diabetes. Now, this is a small randomized controlled trial by Dr. Barnard's group looking at diet and diabetes. And they took 99 people with type 2 diabetes and randomized them to the American Diabetes Association diet or the plant-based diet, and a healthy plant-based diet. And those in the healthy plant-based diet arm lost significantly more weight, and their LDL cholesterol fell significantly more. And if you exclude the people who came off or had modifications of their diabetes medications, because, you know, if their blood sugar is falling, you're going to have to pull them off. So if you exclude the people who, did not have their medications changed, the hemoglobin A1C in the vegan plant-based arm fell significantly more than in the American Diabetes Association diet. But overall, although there was a trend toward additional lowering of the plant-based arm, it was not significant. This is also great work from Dr. Du from their population in China. And what they asked is, if you eat more fresh fruit, is that associated with more incident diabetes, less? Well, in this cohort analysis here of about 480,000 people, consuming more fresh fruit was associated with a lower hazard of incident diabetes. Okay, but what if you had diabetes at the get-go? Is eating more fruit not helpful? Is it helpful? Well, they asked that question. They looked at all-cause mortality, and there were about 30,000 people in this cohort who had type 2 diabetes from the beginning. And even in that cohort, the more fresh fruit you ate was associated with living longer, also with fewer microvascular complications like kidney issues. Okay, impact of a plant or more of a plant-based diet. We touched on cardiovascular health, cholesterol, interesting Dr. Jenkins randomized trial, inflammation, evade CAD, blood pressure, DASH diet, weight, Seventh-day Adventist, Turner-McGreevy study, diabetes, multiple prospective cohorts in the Barnard study. How about some novel risk factors and quality of life? So we talked about that study about our genes, that we can't change our genes, but we certainly can change our lifestyle, and even in the face of unhealthful genes, we can certainly improve our chances of a good outcome. And I guess I should rephrase, because now with CRISPR technology, we may be able to change our genes, but that's not mainstream yet, of course. But there's an interesting study done by Dr. Ornish that touches on this. Now, putting CRISPR technology aside, our eye color is our eye color, our hair color is our hair color. We can't change that from a gene perspective. But we may be able to change which genes talk. And what do I mean? So in Dr. Ornish's study, they took people with early stage prostate cancer. It was not randomized. And they gave them a healthier lifestyle, with eating much more plant-based nutrition, exercise, and psychosocial support. And they biopsied the prostates at baseline and after about 3 months. And after about 3 months, many pro-cancer genes were downregulated in their expression, and many anti-cancer genes were upregulated in their expression. So you could not change your genes, but you were able to seemingly change which ones speak, making the healthier ones speak more loudly and the unhealthy ones speak more softly. It's pretty cool. Of course, the microbiome is incredibly important, and we're really just scratching the surface of that. You know, there's 1 trillion of them in one of us, in each person about. So you could really say that we're the parasites, not them. But it's pretty clear that eating a high fiber, more plant-based diet leads to a more healthful microbiome population, which contribute to our health in a myriad of ways, like a symphony. One such way is by eating higher fiber foods that the microbiome consumes. They then make short-chain fatty acids like butyrate that seep into intestinal cells, making them more healthful, down-regulating gene expression for cholesterol formation there, and also reducing inflammation throughout the body, improving insulin resistance as well. And jumping ahead to endothelial progenitor cells, there have been a few interesting analyses where if you have more endothelial progenitor cells in your blood, that's associated with improved cardiovascular outcomes. And you know, if you think about it, you know, our body regenerates itself over time, our skin, our endothelial cells, its heart, and those endothelial cells come from the bone marrow, and they replace older senescent endothelial cells. And in an interesting small randomized controlled trial, they took young Okinawan women and had them eat their regular diet or their regular diet plus more green leafy vegetables. And those who ate the more green leafy vegetables after 2 weeks were making more endothelial progenitor cells. How about quality of life? Clearly, as you all know well, it's an incredibly important part of life and our work as physicians and caregivers, but it's often sometimes given a little bit of afterthought. And this is changes in plant-based diet quality and health-related quality of life in women. And increases in a healthy plant-based diet was associated with improvements in physical and mental health-related quality of life in women, as measured by the validated SF-36 score. So the impact of a plant-based or nearly plant-based diet, we touched on cardiovascular health, lowering cholesterol, inflammation, blood pressure, weight, diabetes, novel risk factors like gene expression and the microbiome, quality of life. How about mortality? Well, this study looks at changes in plant-based diet quality along the lines of it's never too late to start and total and cause-specific mortality. This has about 700,000 person years of follow-up, and compared with persons whose indices remain stable. Among those with the highest quintile in diet scores, if you had a healthy diet, you had a 10% lower hazard of mortality. And if you had an unhealthy diet, unhealthy plant-based diet, a 12% increased hazard. This is a recent study by Dr. Willett's group, Fruit and Vegetable Intake and Mortality, results from 2 prospective cohort studies of US men and women and a meta-analysis of 26 cohort studies. So in their cohort of the 2 prospective studies, 5 versus 2 servings of fruits and vegetables a day was associated with a 13% lower hazard of death And in a meta-analysis of those 26 cohort studies with almost 2 million subjects from 29 countries, they saw the same 13% reduction in mortality with 5 versus 2 servings per day of fruits and vegetables. It's quite impressively consistent. In a separate meta-analysis of 16 prospective cohorts, each serving of fruit and vegetable was associated with a 5% reduction in mortality. And this is a very recent study just published in March. This is the degree of adherence to plant-based diet and total and cause-specific mortality. The prospective cohort study in the Million Veteran Program. In this Million Veteran Program, they only had 300,000 people in this analysis. I think that's because these were the people they had baseline food frequency questionnaire data in. And they looked at deciles, and the highest versus lowest decile of a healthy plant-based diet was associated with living longer, and the opposite in an unhealthy plant-based diet. Now, we do not need to have perfection be the enemy of good. Every step in the right direction can be helpful, and this study touches on that specifically. And it's published by Dr. Song in JAMA Internal Medicine in 2016. With about 130,000 people with about 3.5 million person years of follow-up. And they asked, if you replace just 3% of your calories from animal-based protein with 3% of calories from plant-based protein, is that good? Is it not good? Well, in this analysis, it turned out it was good. And they had so much data, they could break it down by type of animal protein. So if you replaced just 3% of your calories from processed red meat with 3% of calories from plant-based protein, that was associated with 34% lower hazard of death. Unprocessed meat, these are all significant. Unprocessed red meat, 12, poultry, 6, fish in this data set, 6, eggs, 19, dairy, 8%. And I want to shift a teeny bit. A question that I very frequently get is about an animal-based ketogenic or an animal-based low-carb diet. And I stress animal-based because there's not nearly as much data on a plant-based ketogenic or low-carb diet. And there may be some benefit there, but we don't know specifically. But in terms of an animal-based ketogenic diet or a low-carb animal-based diet, I think the underpinnings of its benefit is based on a popular myth. And that myth goes something like this. In 1980, they told us to eat low fat, and look at us now, we're fat and sick. Well, yes, we are fat and sick, but we didn't eat low fat. We didn't do what they said. We ate more of everything, including fat. So I think it's just fake news, that popular compelling myth. And no long living society lives in a state of chronic ketosis, suggesting that it is not beneficial to chronically be in a state of ketosis. Now, the Inuit population, the circumpolar Inuit population, are often romanticized. They eat a lot of fish, live very long. It's not true. In more recent analyses, their cardiovascular event rates are similar to those living in Canada. And interestingly, the Inuit population, I mean, it makes sense they eat a lot of fish because I guess pre a lot of global warming, it was hard to grow an apple tree so far north. So they had to eat a lot of animal protein, but they actually were more likely to carry a mutation that makes it more difficult to go into a state of ketosis, suggesting it's not beneficial to be in a state of ketosis. And if you look at the blue zones are 5 zones across the globe where they have the most centenarians. In the Seventh-day Adventists in Loma Linda, California. There's a couple in Okinawa, in the Mediterranean, and one in Costa Rica. Anyway, those places where they have the most centenarians, their diet is at least 50% carbs. Longest living people are eating their diet more than 50% carbs. And it's not sugar cookies, it's tubers, it's beans, it's lentils. And the C-A people, I recommend you take a look at this article published in Lancet in 2017. It's really fascinating. And the C-A people, they're an indigenous population in the jungles of Bolivia. They have the lowest rates of heart disease ever recorded in the medical literature. And they were, that was assessed by coronary calcium score, which is pretty wild that they could get that information on them. Their diet, the lowest rates of cardiovascular disease ever recorded in the medical literature, their diet is 74% carbs. And of course, it's not just diet related, they're very active. They have a lot of family and social supports. And they interestingly had higher levels of inflammation, felt to be due to a number of foot infections because some of them were barefoot. But more than their diet, 74% carbs. And in this related small randomized trial in a metabolic ward at the NIH done by Dr. Hall's group, they looked at a ketogenic diet versus a low-fat plant-based diet. And their primary outcome was energy intake, because some people will espouse that if you are in a state of ketosis, you're going to want to eat less, so you'll lose weight that way. Well, this was an ad lib energy intake. And so these people could eat as much or as little as they wanted, and they were crossed over from groups. So you can see for the entire 2 weeks, the low carb arm ate significantly more calories than the low fat plant-based diet arm. And they looked at a variety of other metrics, secondary outcomes. If you look at LDL cholesterol, in the plant-based arm, it was significantly lower. Triglycerides were significantly lower in the low carb arm. Glucose was about the same, and CRP inflammation was significantly lower in the plant-based arm. There's a variety of epidemiologic studies that show that eating a more of an animal-based low-carb dietary pattern is not helpful. Probably the one particularly of interest to us is the one by Dr. Lee, published in the Journal of the American Heart Association now back in 2014. These were post-myocardial infarction patients, and they found that those consuming more of a animal-based low-carb dietary pattern actually did worse from cardiovascular outcome perspective. And there's a variety of mechanisms as to why that may be the case. Heme iron is pro-inflammatory, Nu5GC. Nu5GC is a salicylic acid that's on the cell membranes. It's a real fascinating story, actually, on the cell membranes of non-human primates. And these investigators in San Diego noticed that, when true carnivores, which we're not, but true carnivores eat more red meat, they don't seem to have a problem, but we seem to have trouble with that. They speculated that maybe Nu5GC has something to do with that. So they created an animal model, a mouse model, I believe, which did not have Nu5GC on its cells, and they fed it red meat that had the usual Nu5GC. And that animal model, they ate the red meat, and they incorporated the Nu5GC from the red meat they ate on their cell membranes. And the body of those animals saw it as foreign and attacked it, creating an inflammatory response. They had 5 times more liver cancer and more inflammation. And in human models, it seems that is associated with more inflammation. But so they speculated that may be one of the mechanisms behind why consuming red meat may not be helpful. Overall, there's 64 times more antioxidant in plants versus animal-based foods. In one specific example, berries have 90 times more than fish. And of course, eating an animal-based diet can lead to what appears to be a less healthful microbiome. And in terms of an animal-based ketogenic or animal-based low-carb diet, we need more hard outcomes, and there's a lot of side effects as well, because clearly, of course, it can be helpful in a pediatric epilepsy population. And you're leaving out some of the healthiest foods in the world: whole grains, pulses, and fruits. So in summary, there's no long-living population that's in a state of chronic ketosis, no hard outcomes. We need some safety data. Epi and mechanistic studies don't support benefits and suggest harm, and you're giving up some of the healthiest foods in the world. This is an interesting dietary breakdown of plant-based versus Mediterranean, which is also a wonderfully healthful dietary pattern compared to how people typically eat, versus an animal-based low-carb diet. And the plant-based is equal parts tomato, spinach, lima bean, peas, and potatoes. The Mediterranean is 40% of the plant-based arm, a half a piece of skinless chicken, 1 teaspoon of olive oil, 1 cup of 1% milk. And the low-carb, animal-based low-carb is equal parts beef, pork, chicken, and whole milk. So if you look at different nutrients, you look at cholesterol, you don't need to eat any. Your body makes all you need. How about protein? Oh my God, my muscles are going to fall apart tomorrow. You don't have to take my word for it. You could take Patrick Baboumian's word for it. Patrick Baboumian is vegan, and Patrick Baboumian is the world's strongest man. How do I know that he's the world's strongest man? Because he won the world's strongest man contest. That's how I know. Beta carotene, dietary fiber, your constipation will go away, calcium, my bones are going to fall apart. And of course, the American Heart Association, American College of Cardiology guidelines, class 1 guidelines, recommend a diet emphasizing intake of vegetables, fruits, legumes, nuts, whole grains, and fish to decrease atherosclerotic cardiovascular disease risk. So it is primarily plant-based. And they also say a plant-based diet in isolation can be quite healthy. And the Association of Nutrition and Dietetics in the US say that an appropriately planned vegan diet can be healthful throughout the life cycle, and appropriately planned basically means taking B12. Let's circle back to our guy. He went plant-based. Remember, he wasn't interested in any medications, procedures, went plant-based. His BMI normalized after 3 or 4 months, blood pressure normalized, LDL cholesterol fell a lot. And he could walk about a mile and he would stop because he'd get chest pain. Fast forward about a year, BMI normal, blood pressure normal, LDL cholesterol low, even lower. He could jog 2 miles and he'd stop because he'd get a little bit of discomfort. And I bumped into him 4 or 5 years ago, and he jogs 4 miles now and stops because he gets bored. This is a great quote. Today, no one can deny the possibility of adequate nutrition and the prolonged maintenance of health and vigor on a vegetarian diet. That's from the Journal of the American Medical Association in 1912. And of course, there are other benefits. There are planetary benefits, global warming benefits. Animal agribusiness, of course, creates more greenhouse gases than all transportation combined. And who cares how healthy you are if there's no planet, no health. And of course, eating more plant-based nutrition has been modeled in a UK and Belgium study to substantially lower the cost of healthcare. So in this, so far, we've touched on cardiovascular health, cholesterol, inflammation, blood pressure, weight, diabetes, novel risk factors, quality of life, and mortality. And if I have a couple more minutes, I can touch on erectile dysfunction, or if it's time to break for questions and answers, I'll be happy to do that as well.
I think everyone would be interested. Rob, go ahead.
Okay, thank you. So erectile dysfunction is, the definition of it is the inability to attain or sustain an erection satisfactory for sexual performance. There is the International Index of Erectile Function 5, IIEF-5 score, which is often used to slightly more formally define erectile dysfunction. And there's 5 questions in a score, 5 points for each, up to 5 points for each question, and no ED is 22 to 25. And for example, one question is, how do you rate your confidence that you can get and keep an erection? And so they have a number of questions. Erectile dysfunction is common. It's often called the canary in the coal mine for cardiovascular disease because it typically presents about 2 to 3 years before angina and about 3 to 5 years before cardiovascular events. Now, why might that be? Well, one of the reasons, and we'll dive into this a little bit more, that people can get erectile dysfunction is from vascular disease. I mean, basically atherosclerosis in the artery to the penis. And the artery to the penis is smaller than the artery to the heart. So by the time someone has a blockage in an artery to the penis that's causing erectile dysfunction, it's very likely that they have atherosclerosis in the coronary arteries, but that just have not yet clinically manifest. And we know, of course, that atherosclerosis is a systemic disease. And in terms of how common it is, this is from the Men's Massachusetts Aging Study. And about 15% of men from 40 to 59 years of age reported ED, and 70% of men in their 70s. But I think it's a lot higher than that because people just don't like talking about it. And even if you just think about, this study was from 1994, health in general, at least in the US, has substantially worsened. We're fatter, we're sicker. So even just from that metric, it's likely to have gone up. What causes it? It's most commonly in the Western world a vascular disease, but of course there are other reasons: neurogenic, hormonal, drug-induced, psychologic, mixed. So it's important, of course, to keep all of those in mind. And epidemiologically, it's important. The presence of erectile dysfunction in this prospective cohort study was associated with a 40% greater hazard of mortality versus no ED. And vasculogenic risk factors are associated with greater odds or incidence of erectile dysfunction. And looking at a few, diabetes is associated with a significantly higher odds of erectile dysfunction. High cholesterol is associated with the significantly higher odds of erectile dysfunction. Obesity is associated with the significantly higher odds of erectile dysfunction. High blood pressure, inflammation, tobacco use, all associated with the higher odds of erectile dysfunction. And there is clear randomized data that eating a more healthful dietary pattern, like a Mediterranean diet, which is largely, but not exclusively plant-based, includes fish and some white meat, but lots of vegetables, fruits, whole grains, beans, and lentils, and also with weight loss and exercise, can all improve erectile function. The one thing with exercise I should point out is the one exercise that can be of concern is bike riding. Because if men sit on, and probably for women too, if they sit on the narrow seat and it doesn't have that little divot, that can push on the pudendal nerve and pudendal artery, damaging it over time. So it's recommended that you be sure to get a seat with one of those divots to protect the pudendal artery and nerve. And of course, there's cross-sectional analyses that eating more plants is associated with less erectile dysfunction, but erectile dysfunction is common. It's the canary in the coal mine for cardiovascular disease. Risk factors for ED overlap with risk factors for, not surprising, with cardiovascular disease. Lifestyle changes improve both cardiovascular disease risk and erectile dysfunction. And potential improvements in erectile function may prove uniquely motivating. It's one thing, if I tell someone maybe their blood pressure could fall, it's another thing if I can tell them they can improve their erectile function. We're about to launch a randomized trial in erectile function, which I'd be happy to talk about in the Q&A section. This is a great quote from Dr. Kim Williams, a past president of the American College of Cardiology. I recommend a plant-based diet because I know it's going to lower their blood pressure, improve their insulin sensitivity, and decrease their cholesterol. He's also said there are two kinds of cardiologists: vegans and those who have not read the literature. That's a quote from him. This is where we are based, where I used to have the opportunity to work with Dr. Medina here in the Bronx, New York City, which is the least healthful county in all of New York State. So unfortunately, we see a lot of these diseases. And if anyone's interested in more of an overview on nutrition and cardiology, we were fortunate to be able to make a cardio nutrition podcast that's through the American College of Cardiology. It's free to download. It's like 15 brief interviews about various nutrition topics. And thank you so much for the honor of inviting me and allowing me to present to you today.
Thank you, Rob. That was spectacular as always.
Sigue, Héctor.
Adelante, Fernando, adelante.
Oh, thank you, Dr. Ostfeld, for your excellent presentation. We will continue with a question and answer session. ¿Alguien de los asistentes tiene preguntas en el chat? Creo que no. Yo tengo varias preguntas para el Dr. Ostfeld. La primera ¿es útil medir los niveles en sangre de trimetil aminoóxido, de TMAO?
I don't fully understand the question. My Spanish isn't that great, but my understanding of it is about more or less the impact of a plant-based diet on trimethylamine oxide.
Yes, Rob, that's it.
Medir levels in blood tests of TMAO?
Right. So I don't personally send those tests. I've seen them from time to time. It's not clear to me how it's going to change my management yet. There's great work, of course, by Dr. Hazen's group and with Dr. Tang out of Cleveland Clinic, clearly showing that consuming more animal-based foods, in particular red meat, can raise trimethylamine oxide levels in the blood, which seem to promote oxidative stress and atherosclerosis. There's some debate about causality there, but there is a strong pathophysiologic rationale. From my perspective, if the TMAO is low, intermediate, or high, I'm still going to want to have my patients eat a smartly or minimally processed plant-based diet. I'm not aware of any intervention at this point that would direct it specifically to TMAO. So it wouldn't really change my management. There may be medications or things coming up, maybe something I don't know about, but no, I do not measure TMAO levels.
Fernando, yo tengo una pregunta que me mandaron, la voy a hacer, ¿le parece?
Claro.
Rob, they're asking on the questions Q&A about depression and if the incidence of depression in plant-based diet it's higher. And the person who's asking the question is saying that the incidence of these mood disorder, it changes from study to study. What's your impression about these, and what's your also clinical experience, granted you're a big advocate of this type of diet?
That's true. Yes. Thank you. And I know the study you're talking about, and I'm not going to remember all the details. There was an analysis, I think it's out of Epic Oxford, the UK part of it. There was a number of biases that I think meaningfully weakened the conclusion of that study. And part of it, and I'm not going to remember all of it, but so I apologize. So I don't put much weight on that particular study, but part of it is in the plant-based arm, at least in the UK version of Epic Oxford, if you look at their fiber content, it's extremely low. So the version of plant-based diet that they are eating is not a healthful one. It's the unhealthy sugar cookie one, which from the SF-36 score study is associated with, worse quality of life. Also, in some of them, they didn't supplement vitamin B12. Now, B12 lives in the soil, and animals get it because they eat soil, or other animals that eat soil. Nowadays, if we go to the store here, at least in the US, you go buy some spinach that's like triple washed and all the dirt's gone. So you're not getting the B12 that way. So you are at risk of not having enough B12, but there's so much pesticide used in the soil now that it's killing those microbes. And lots of people who eat animal-based foods are B12 deficient now more and more as well. So it's a nutrient of concern really for everybody. And so I don't think that study is strong. And I think there are others to support the opposite. But I'm very open to, when there's, randomized trial, things like that are stronger bodies of evidence to being swayed. But I don't think that is accurate for a healthy plant-based diet.
Thank you, Rob. Adelante, Fernando, si tiene una pregunta. Yo tengo una también por el chat, pero adelante, por favor. Si tiene una.
Dr. Ostfeld, what is the main cause we went from consuming 120 pounds of meat a year in 20th century to 220 in 21st century.
And so the question is, what's the main reason we went to basically consuming 100 pounds more of meat a year?
Yes.
Yeah, I mean, the main cause, I don't know. That's a great question. To me, it seems like a societal level issue, with fast food that's cheap and at least in the US subsidized by like a $40 billion a year farm bill that makes, promotes animal agribusiness. That's a great question. I think it's more of a policy societal level answer to that. I'd be curious if you have a more specific answer.
Thank you, Dr.
Rob, we have a question here about if there's a difference, a racial difference of the impact in plant-based diet. And the question goes along because, Bronx is such a unique, borough in terms of diversity of populations. There's Latinos, there's African Americans, there's also white population. Have you seen or have you noticed or in the evidence you showed us, do you think there's a difference, an interaction difference depending on the race and getting into these diets?
Broadly, I think not. And there are a couple of studies that quickly come to mind. Of course, as you're all well familiar with, there's this SOL study of Latinos. And Einstein, this is a US-based study, and Einstein is one of the centers. There's a very large Hispanic population, of course, as you know, here in the Bronx, as well as many other places in the US. There are 5 centers in the US, and I apologize, I don't remember all of them. And for a time here, I was a study cardiologist for it. And there have been a number of studies looking at more healthy plant-based diets versus unhealthy plant-based diets in the study of Latinos. And to the best of my recollection, some of them have been presented as abstracts. The theme is the same. Eating more of a healthy plant-based diet improves a variety of health metrics. There's the REGARDS study, which is a prospective cohort study I think it's more based in the southern US, which has a larger African American population. And the Southern dietary pattern, which is a lot of fried foods and was associated with a variety of worse outcomes across a broad, I think that had a much broader ethnic/racial diversity in that data set. So to my knowledge, there's no meaningful interaction or difference by race. If someone knows differently, I'd be happy to see that study.
Thank you, Rob. Adelante, Fernando, si tiene otra.
Sí, yo tengo otra pregunta. Dr. Ostfeld, in your order, what influence more in the lack of adherence to healthy diets? Education, human attraction to sweet and salty, marketing, cost, or food desert or swamp?
Great question, and my answer to your question is yes, all of the above. And I think the question is what might contribute most to an unhealthy dietary pattern. And quite frankly, I think everyone's a little different. I think they all do. As a society, we are not good at making the healthy choice the easy choice. You're right, there are food deserts where it's hard to find healthier food, but even when they correct that and they put healthier food there, it's clearly been shown that people don't eat it or purchase it. And so there's much more to it than that. There's marketing, and for many years here in the US, it was like, beef, it's what's for dinner. It was like the manly man stuff, which is, you could argue in some respects is an erectile dysfunction starter kit. So I think marketing plays a role. I think governmental policy plays a role with animal agribusiness. I think culture plays a huge role. You know, grandma and grandma's grandma used to cook this particular meat sauce dish, and it's passed on from generation into generation, and it's more than just taste. It's, you know, family history, and that plays a role into it as well. So there's a lot that obviously goes into personal dietary choice. And there's some serious headwinds. There's a lot to tackle. You're absolutely right. And I don't know that one plays the biggest role. I think they're all very important.
Thank you, Dr. Ostfeld.
Fernando, ¿le parece si cerramos ya, siendo las 2:05?
Claro que sí.
Okay, Rob, I think we got an amazing, talk. Thank you so much. I'm getting comments here congratulating you about the clearness and the strength of your evidence. Gracias, Fernando, también por su moderación. It's been an honor, Rob, to have you here, really, and I'm so happy, about your career progression. It's great to know you're doing such an amazing job, and hopefully one day we can have you here for learning even more so about these necessary skills for educating patients and implementing plant-based diet on our intervention armamentarium. Thank you, Rob.
Thank you for your generous comments, and it's just been great, and your wonderful questions, and it's been great to be here with you all. Thank you.
Muchas gracias. Gracias, Fernando.
Gracias, Héctor.
Bueno, have a good afternoon and a good weekend, Rob, and buen fin de semana para todos. Gracias.
Thanks, Hector. It's great seeing you. You look great.
Thank you. Likewise, Rob. Take care. Bye-bye.